the culture of our institution is led by our president and CEO, Dr. Kurt Newman, a surgeon who has continuously reminded us, if we make our decisions with the child and the family at the center of our decision making, we put our feet into their shoes and say, if I were they, what decision would I make? Then that really helps drive the institution to the right goals. So I notice when you walk around the unit or you're making rounds in the intensive care unit, you expect your team to know the name of the baby. It's too easy for us to talk about maybe the TGA in bed space 10 or baby girl Smith, but you expect your team to know not only the last name of the baby or the child, but the first name as well, and connect with that child and the family. Tell us a little bit about your philosophy toward the family and treating the whole family.
What I want is that the parents and the family go here, and it's an extremely distressful moment, but this is their home when their kid is sick. And that's the one, I want them to feel that way. I want this environment to be as comforting as possible. I want this environment to be prone to healing. One of the things, as you said, knowing the baby by the first names. I mean, last week I went to a room and I had to, the nurse had to look back and to know what's the first name of the baby. And so I'll keep chasing the babies. Even some families give names to the fetus at a very early stage of pregnancy. And that fetus has a name, and so it should be respected. I tend to use, I have a difficult last name, so Dr. Yves is fine, and there's not a lot of Yves in pediatric cardiac surgery. So I said, if you remember Yves, you'll be able to track me down, you'll find me. The other thing is I like to do is that I talk to the kids as well. Starting at 10 or 12, they're independent person. First of all, when I talk to the kids, likely the mom and dad understand better what I explain, because I explain in a better way. And I think it's their condition. They should be part of it. For me, it's very important. It's not only providing best results, it's the way you do that. And it's the way, we work as a team too. It's very important for me to have perfect results. I want these centers to be the best one in North America or in the world, but not at all costs. I want it, the how we achieve that is very important to me too. I want the people to be happy to come at work in the morning. And if the people who are coming here are happy to come at work in the morning, the families will feel that too.